Stay ahead of our health in 2023.
Yeah. Dr. Samson Davis is an emergency room physician. Dr. Jessica Shepard is a OB-GYN, and Dr. Jonathan Levine is a dentist. Welcome, you guys.
We're so happy that y'all are here. Each one has their own panel, so we'll let you guys splinter off and head to yours. And we're going to start with you, Dr. Samson.
Yes.
Okay, you say that it's very important to make our annual appointments.
Yes, very important, especially now that we're moving past COVID. You want to make sure you get those annual appointments in. So link it to your birthdays, end of the year, beginning of the year.
Same time each year, so you remember.
Same time each year.
Yeah.
And for the kids, it's usually more frequent, especially the younger ones, because of the immunizations that they have to receive. Exactly.
So what do we do? What do we want to make sure we're asking our doctors in these appointments?
Anything that's bothering you, of course, you want to ask. But just the routine, make sure there's no fluctuation in your weight. Make sure there's no extra fatigue.
Should you do blood work each time you go? Each time you go for a checkup?
So I like blood work every year. Simply your cholesterol, check your glucose, make sure you're not pre-diabetic, your blood pressure, you can check your kidney function, make sure you're not having any issues there.
Vaccines, tell us about them.
Vaccines, so COVID, of course, right? That's the big one. Your COVID boosters, please make sure. Flu hit us hard this year along with RSV, so make sure you get your annual flu shot. The pneumococcal vaccine, age 65 and older, is very important. Shingles, totally preventable. Age 50, you could get your shingles.
Oh, wow.
Should you definitely get that?
You should definitely get that. Shingles are very painful. Very painful.
Yeah.
It's the reactivation of the chickenpox virus, but just in a segment. And HPV, totally preventable as well.
Okay, our mental health's important too. We got to check it.
We've seen a lot of change, and I'm especially in the emergency department with kids, especially since COVID now is over. Anxiety, depression, post-traumatic stress. Panic disorders. So we have to make sure you check in with your loved ones and make sure they're doing okay.
Are there any other screenings we should know about?
I mean, we talk about the prostate exam. That's very important. 40 to 54 is the range. The higher risk you have, the earlier you start. The PSA is important to have as well. If you see an increase in PSA, you may have to have a digital rectal exam to make sure the prostate is okay. Colonoscopies begin at age 45.
Every year, go to the dermatologist.
Yeah, awesome. Thank you.
Dr. Jessica Shepard, OB-GYN, it's good to see you.
Yes.
Okay, this is something that usually women are supposed to do this annually. Is that right?
Annually, and then also knowing for screening tests. Screening tests are really to help with screening labs and tests to find something that may not be symptomatic in you. So it's important to know that, important to know ages. So when to go to the gynecologist.
Yeah, when?
Every year. You want to see us every year.
Yeah,
I'm sure you
of
do.
course.
Yes. But talking about what you should do at a particular age, PAP is obviously where you're going to come and see us for when to do it. So PAP is going to be done through the ages of 21 through 29 every 3 years.
Every 3 years.
Tack on that PAP plus HPV, also known as co-testing, starting at the age of 30 through 65 every 5 years. Obviously, if you have abnormalities, you want to talk to your doctor about that. And STI testing. I think people really overlook this every year, whether you're married, widowed, divorced, doesn't matter, single. And if you start to have a new partner, get an STI test.
How about breast health? That's important.
Yes, breast health is so important. 1 in 9 women will have breast cancer in their lifetime. But digital breast exams, now not many organizations recommend this, but they also do recommend to know your breast tissue, to know how it looks, how it feels. So you would go to your doctor if you saw something that was abnormal.
Irregular,
Starting at the age of 40, they have changed the recommendations to start annually at the age of 40. And then also for MRI, that's important. If you have a 20 to 25 risk of being breast cancer, of having that diagnosis, getting an MRI and a mammogram every year, starting at the age of 30 for high risk.
Does insurance pay for that?
They do if you can show some type of high risk necessity.
Let's talk checking the thyroid. This is important for women.
This is a tiny gland, but it has a big job, and it really helps with metabolism, energy, and how you store your energy. So you really want to start screening at the age of 35. There are different recommendations, so I really advise people to talk to their healthcare provider when they should start.
And bone density is a big one too.
Yes, because brittle bones, especially after menopause, when you start to decrease estrogen, getting your bones checked starting at the age of 65 with your DEXA scan.
Thank you, Doctor. Okay. Dr. Levine, we're at the dentist. People don't like going, but we're here.
Oh, it's different today.
Is it different?
It really is. With our new technology.
Let's talk basics. Brushing teeth, important.
Okay, the most important thing, there's a connection between oral health and overall health. And if you have inflammation in the mouth, there's 58 systemic inflammatory diseases now connected to the mouth. So I'm just setting the stage of why it's so important to control the plaque in our mouths. It really has to become a priority. So brushing it's simple. Twice a day, 2 minutes each time, each quadrant. I hop on a foot.
Yeah.
You know, you just try to distract yourself, but you got to get focused on it.
60% of men only brush once a day?
Yeah.
Why?
Well, if they're focused on white teeth and good breath, they're going to brush more. But,
wow, that's a high number.
Right. 1 out of 2 Americans have periodontal disease. That's chronic inflammatory disease.
Okay,
so we could do better.
We don't have much more time, so tell us the keys.
So the key with flossing is you got to do at least once a day, brush twice a day. Dental cleanings, get into the dental professional twice a year because it's all about getting to problems early.
Right.
It's, with everything, right? Basic dental x-rays once a year. Full mouth series every 5 years. Now we have this new technology called CBCT where you can see so much structure with very low radiation.
Yeah.
And the oral cancer screening, so critical.
Yeah.
The morbidity rates haven't changed in 50 years. It's on the rise because of HPV virus. Every time you go to the dentist, demanded, you got to have
So you have to ask your dentist.
Demanded, only 15% of the dental professionals are actually looking at these oral screening techniques. And there's some amazing ones happening that are looking at the the genomics of the saliva so we can really get ahead of it. But there's a company called Velscope where you take the special picture, light in the mouth, and you can see the dysplastic changes in the tissue. So demand for your dental professional.
Who knew?
Demand it.
By the way, that's great. That's great to know. Often you go in and just say, what should I do? And then you leave.
Thank you.
Thanks, Dr. Levine.
You bet.